All right. Well, thank you so much, everybody, for being here tonight. My name is Courtney Johnson. I am the Director of Development and Community Relations at the Epilepsy Foundation of Kentuckiana. We are so happy to have everybody here tonight. We have a special guest, Stephanie Lennox, is here with us tonight, and she's going to talk about understanding thinking and memory in epilepsy. And I'm really interested to see how all of this information comes about and all of the connections to day-to-day lives, and it should be very applicable for everyone. So, a little bit about Stephanie Lennox. She is a neuropsychologist with U of L Physicians Neuropsychology Clinic, which is part of the U of L Health Brain and Spine Institute. Her areas of interest include epilepsy, neurodegenerative diseases and dementias, stroke and cerebral vascular disease, traumatic brain injuries and concussions, and she is part of the multidisciplinary pre-surgical epilepsy team at U of L Health. She also has a strong interest in enhancing how patients receive and understand health information. Dr. Lennox received her doctoral degree from Nova Southern University. She completed her internship at Cincinnati VA Medical Center and her fellowship at University of Virginia, both in clinical neuropsychology. Thank you so much, Dr. Lennox, for joining us. I'm going to turn it over to you. If anybody has any questions, you can type them in the chat, but we will save them to the end.
Thank you, Courtney. I'm going to share my screen. And I want to make sure that you all can see that okay? Okay. Thanks, Courtney. So I am a neuropsychologist, which essentially is a fancy term for a psychologist that has specialized in brain behavioral relationships, or essentially what I do on a day-to-day basis is checkups of thinking skills. And I see many individuals with epilepsy in my clinic, particularly for pre-surgical reasons, or also because they've noticed changes in their thinking skills and have expressed concern to their neurologist or their provider, and they are referred to me for further evaluation. And today, I really want to focus on understanding thinking and memory beyond epilepsy. So, it is an estimated 30 to 50% of individuals with epilepsy experience some degree of change in thinking skills, such as memory, attention, speed of thinking. And when discussing epilepsy and cognitive change, the focus is generally on those seizures, the type of seizure, the location or locations of seizures, the length of time one has had seizures, the frequency of seizures, or how well controlled are the seizures with medication. While seizures are well known to play a role in thinking skill changes, many other factors can negatively impact thinking as well, such as sleep, medication effects, stress, mood, and other lifestyle factors. And for today's presentation, we're going to be focusing on these other factors that are not seizures, but can also impact thinking skills in epilepsy. And we want to explore these modifiable factors and to learn steps to improve thinking skills and essentially improve overall quality of life. So first, I want to discuss how the brain supports cognitive functions or thinking skills like memory and attention and processing speed. So cognitive functions refer to the ability to think, learn, remember, reason, make decisions, and complete goal-directed behaviors. One of the primary cognitive complaints that I hear in clinic from my patients with epilepsy is memory loss. And it's important to understand that memory involves three processes. First, you have to learn or encode the information. You then store the information, and then you have to pull that information out. Now, the hippocampus is a part of the brain that is essential for memory storage. Another common thinking skill complaint is difficulties with planning, problem solving, and decision making, which the frontal lobes are often responsible for. Even when seizures are not occurring, underlying brain changes in epilepsy can affect these areas. And beyond the direct effects of seizures, various other factors related to epilepsy can influence thinking skills, which is why understanding brain function is critical. So first, I want to go into sleep. Now, sleep plays a very significant role in our thinking skills, and many people with epilepsy experience sleep disruptions, which can lead to worsening thinking skills. Sleep is when our brain repairs and recharges and it is important also for the storage of memories. I like to think of sleep as kind of the time where there's a cleanup crew that comes through and helps to store those memories that we've had from the day before. Poor sleep can result in reduced attention, processing speed, and problem solving. Lack of sleep not only makes things harder for individuals with epilepsy, but it also increases seizure risk. So for individuals with epilepsy, they are more likely to there are higher rates of sleep disorders in individuals that have epilepsy, such as insomnia, restless leg syndrome, and sleep apnea. And the fatigue and daytime sleepiness that are common side effects of anti-seizure medications also play a role and can affect sleep. So sleep is a critical component to good thinking skills. And prioritizing good sleep habits is key to both brain health as well as seizure control. Now, how do we improve sleep for better cognitive functions? A lot of times my patients come to me and they're like, oh, I really want to try sleep medicines. I want to try sleep medicines. Well, in fact, individuals that take sleep medicine, that might work for a bit. However, eventually people do tend to get used to that medication and it becomes less effective over time. So often I'll ask my patients, hey, have you ever been worked up for insomnia or sleep apnea, both of which can cause significant cognitive problems? I'm also aware that certain anti-seizure medications, such as zonisamide, phenytoin, felbamate, lamotrigine, can negatively impact sleep. So I often will say, we need to get worked up by our providers for sleep apnea or insomnia, if we think that that's something that we're dealing with, as well as discussing with our treating provider about your medications, if you think that that might be disrupting sleep. One of the most probably well-known, but maybe not as well-known, is just sleep hygiene strategies. And that's something that I often will recommend to my patients. These are simple sleep strategies like maintaining a consistent sleep routine, limiting caffeine in the afternoon, and different strategies to help improve sleep. If you speak with any provider that works in sleep or works within the realm of improving thinking skills, these are strategies, although simple, actually can make a significant difference in improving one's sleep. Developing a sleep routine. If one can't fall asleep within a 20-minute window, getting up and doing something calming like stretching or reading, not pulling out your screen before bedtime. I know that we are all kind of glued to a computer, a television, a smartphone, but it's really recommended not to have any screen time for at least 30 minutes prior to bedtime to help improve sleep. And these are just some of the list of simple strategies that people can use to improve their sleep quality and quantity. Now, the next thing that is well known to affect thinking skills in individuals with epilepsy are anti-seizure medications. While anti-seizure medications are essential for seizure control, they are well known to impact thinking skills. And medications for seizures, being on one medication for seizures is often what I think of as less impactful to our thinking skills. But factors that do influence medication effects and thinking include taking maybe multiple anti-seizure medications can really increase the thinking skill burden. I know that higher dosages increase cognitive side effects. A rapid initiation, so starting a medication really quickly and going up in dosage pretty quickly can also increase the likelihood of having side effects. And also, each individual has a different sensitivity or response to medications. Certainly, I know that when speaking with different individuals I work with, some people experience stronger effects than others. Some people are more able to tolerate more medications. The effects of anti-seizure medications often reported are word finding difficulties, slowed speed of thinking, reduced vigilance, so that ability to pay close and continuous attention. But the effects of medications do vary from person to person. Often when individuals come to me and they're concerned about the effects of their medication, because not every individual with epilepsy will experience cognitive side effects. And like I said, some medications are tolerated better than others. Often adjusting the type, the dose, or the timing of medication can help reduce these effects while also maintaining seizure control. If cognitive side effects are interfering with daily life, it is important to discuss them with your healthcare provider. There are often options to adjust medications to find the best balance between seizure control and your thinking skills. Additionally, being able to time your medications at certain times of the day, such as maybe taking them at bedtime versus in the morning, can reduce cognitive effects. But that's not possible for everyone, as sometimes you are taking these medications 2 or 3 times a day, or discussing with your provider if there are extended release options and things of that nature. Also, just other lifestyle factors, such as ensuring you're hydrated, engaging in mental stimulation, such as learning activities or volunteering or work, school, those things, prioritizing sleep, all of these things can actually reduce the negative effects of anti-seizure medications on thinking skills. Now, one of the next factors that I want to discuss is stress. So we all have stress to some degree, but for individuals with chronic medical conditions like epilepsy, it can be particularly challenging as stress not only impacts seizures and the seizure activity, but also thinking skills. Individuals with epilepsy have a higher perceived level of stress than their healthy peers. And stress results in increased cortisol, which is a hormone made in the brain that can interfere with memory and attention. Particularly, it's chronic stress has actually been studied. And chronic stress can result in a cortisol production that actually can shrink the primary memory center that we actually discussed earlier, the hippocampus. And of course, if you're shrinking the primary memory center, this in turn can make learning and remembering information more difficult. Not only does stress result in memory difficulty, but it can also interfere with concentration, working memory, and processing information. Also, since stress is a common seizure trigger, it can create a cycle where cognitive challenges and seizures reinforce each other. And you can see this in the diagram here. As stress increases, cognitive functions decline, and it results in increased risk of seizures, which then results in more stress and frustration. So managing stress is an important step in improving both cognitive functioning and seizure control. There are many actionable steps to manage stress, from mindfulness activities such as deep breathing, meditation, to physical activity such as exercise, as well as lifestyle habits like hydration and diet, as well as support systems. Not only having a perceived level of a good support system, but also support groups for maybe individuals with epilepsy, as well as maybe even individual psychotherapy or counseling to learn skills to better manage stress. I often will recommend different apps for my patients that are dealing with stress, because one, it's accessible, they're free, and you can do it at the comfort of your home, and they're quite user-friendly. And I wanted to provide some of those apps that I often recommend that I think are really important to help assist people with learning more mindfulness or stress relief in the moment. And most of us are glued to a phone to some degree. So in the moment when we're feeling overly stressed, you have access to that on your phone to be able to use. Now, mood and mental health are closely linked to both epilepsy as well as thinking skills or cognitive function. Many people with epilepsy, about 20 to 30% actually, experience depression and or an anxiety disorder, which can further impact our thinking skills. When we think about the brain mood connection in epilepsy, specific brain regions that control mood are often involved in seizures. Additionally, we know that some anti-seizure medications have been well known to either worsen or actually improve mood symptoms. A lot of anti-seizure medications actually are prescribed for mood symptoms for people that don't have seizures, such as Depakote or lamotrigine. Mental health disorders like depression and anxiety alone, without a history of any neurologic condition or epilepsy, can actually interfere with thinking skills. So in fact, if you look at the criteria for a major depressive disorder or generalized anxiety disorder, cognitive symptoms are part of the diagnostic criteria. Depression can slow thinking, reduce motivation, and disrupt focus, which can interfere with memory. Anxiety interferes with attention and concentration, which can result in problems with focus and learning. Additionally, it is not uncommon for people with significant psychological distress to feel easily overwhelmed or exhausted by more cognitively demanding tasks. So something that requires a lot of brain effort. In my role as a psychologist, I think it is important for my patients to understand, and as well as individuals that have epilepsy, to know how to manage depression and anxiety symptoms to improve thinking skills. I often recommend addressing mental health through therapy and psychotherapy, not physical therapy, not speech therapy, not occupational therapy, but psychotherapy, or sometimes called counseling. I think that there are several different types of really good therapies, particularly evidence-based treatments for anxiety and depression, and tailored to people that have chronic medical conditions, such as cognitive behavioral therapy or acceptance and commitment therapy. Both of these are a little different than just going in and talking to a provider or a therapist. Essentially, it's a very more structured, time-limited, brief treatment that can go for about 3 months or 6 months, and you meet weekly for about 50 minutes. There's also the ability to have support groups, just like I mentioned earlier with stress. There's also the option to discuss medication adjustments, as we had discussed earlier, that some anti-seizure medications can improve mood while others may contribute or worsen depression and anxiety. Mood medications, and there's lots of different types, are also sometimes recommended for improving mood. Now, this might not be warranted for all patients, and this is something that would need to be discussed with a medical physician or psychiatrist. Certainly, mood medications in combination with therapy are actually the most effective treatment for people that have more moderate to severe anxiety and depression, rather than therapy alone or medication alone. For individuals that have more mild symptoms, we usually recommend therapy alone. Lastly, I think that different lifestyle strategies can be super beneficial for improving mood. Sleep, we've already discussed. Exercise is very important. Those previous stress management strategies can be implemented. But one of the big things I like to tell people I work with is about behavioral activation. And simply put, it is a therapeutic approach in which is kind of where we discuss how behaviors can strongly influence our mood. So maybe, for example, when people feel down, they often withdraw from activities, which can actually reinforce and worsen those depressive symptoms. And so behavioral activation works to break this cycle. Essentially, it's kind of forcing oneself to plan activities that provide a sense of purpose and enjoyment. And you schedule these and you participate, even if you don't feel like doing it. And typically what happens is people feel better because it has forced them to do something that they wanted that they enjoy, but maybe they didn't want to do because of the depressive symptoms. And it improves their mood, even though maybe initially they didn't want to. Now I want to transition kind of to discuss more general lifestyle factors that affect thinking and memory. And actually, I was talking to Courtney earlier about many individuals that come into my office are always wanting to know, regardless of what they're presenting with, if they have a neurologic history or if they have other things going on, they're always wanting to know, how do we improve brain health, or how do I improve my thinking skills? They'll ask, oh, are those game training programs that you have to buy, are those going to help improve my thinking skills or my brain health? Or what about those over-the-counter supplements like Prevagen? Are those going to improve my memory? Well, in fact, there's no evidence to support any of those, the over-the-counter supplements for memory, or some of these brain training game apps that are, saying that they're going to improve thinking skills. When in fact, really what I recommend are some basic lifestyle factors that I know can improve and influence brain health, but also thinking skills. First, I want to comment on nutrition. Nutrition is key to good brain health, and doctors have been studying this, and researchers, and we know that often if you're going to a primary care appointment, they're going to recommend eating a balanced, heart-healthy diet low in salt and saturated fats and added sugar. And according to the National Institute on Aging, the Mediterranean diet, which is mainly consisting of fish, beans, olive oil, whole grains, fruits, and vegetables, has various positive brain health benefits. Recent research has actually indicated that individuals that actually adhere to this diet have stronger memory and working memory abilities. So being able to hold information in mind and manipulate it. The diet shows to be anti-inflammatory and in a sense supporting brain health and kind of neuroprotective, so protective to the brain. Next is physical exercise. And physical exercise is one of the most powerful lifestyle tools that we have. It has shown very positive benefits for the brain and thinking skills. And not only does it reveal immediate cognitive benefits, but individuals who exercise over an extended period have been found to experience benefits in attention, speed of thinking, memory, and these higher order thinking skills that we use for goal-directed behaviors, also known as executive function. So planning, problem solving, decision making, multitasking. Physical activity also appears to improve the hippocampus size, as well as the wiring system or the connections in the brain. And it also has been shown to reduce inflammation in the brain. It's recommended to have 30 minutes of moderate, so that's at least 50% of your maximum heart rate, aerobic exercise 5 days a week to really get the benefit of improvement in brain health and thinking skills. Next is social engagement. Experts have found loneliness and social isolation are risk factors for thinking skill changes. Participation in social activities, as well as having a strong social support network, has been linked to increasing overall brain health, mood, and quality of life. It is recommended that you're active in activities that you find meaningful, including meeting up with friends, participating in clubs, community activities, volunteering. They looked at community volunteering as that has been especially found to improve brain health and thinking skills. The next is mental stimulation. Just like exercising the body, it is important to exercise the mind. Participation in these cognitive stimulating activities can improve our brain health and thinking skills. There's also research to suggest that participating in more than one activity, more than one stimulating activity, is even more effective in promoting brain health rather than just participating in one. Activities that I can recommend are learning a new language, quilting, doing puzzles or games, reading, playing a musical instrument, work, activities that are kind of cognitively demanding, attending workshops or lectures just like this one. All of these things are considered mental stimulation that can promote good thinking skills and improve brain health. Last is hearing and vision. I see a lot of patients that have unaddressed hearing or vision loss, which actually can further increase our cognitive load or our thinking skill load and lead to miscommunication and or memory difficulties. I also see that when people have unaddressed, particularly hearing loss, I see that reduces one's engagement in their social environment. Which kind of almost decreases their mental stimulation and their social stimulation. Now that we've discussed all these different factors that can impact thinking skills, the next step you probably are asking is like, what can I do? I often will recommend strategies for thinking skills that can help you work around memory, speed of thinking weaknesses, or attentional difficulties. Even small changes can make a big difference in day-to-day life. And here I've listed a few. I like to think of having strategies for improving thinking and memory as kind of having a toolkit that you use to support your brain. Creating a routine. I think routine is one of the most critical things that any individual can use. Having a consistent daily schedule can reduce kind of that mental overload and forgetfulness. Having a place where you launch and land. So putting important items like keys, wallet, cell phone, and glasses in the same place every day, so you're less likely to misplace them. Using other mental strategies, such as repeating information aloud or in your head to make it stick. Organizing information by making it into story or relating it to something you already know well. I find that that's really important because it helps you remember it if you are able to relate it to something that you already know very well. And using chunking to breaking down information into fewer pieces. A lot of times a good example of chunking is like a phone number. Writing things down. That's critical, and I'm sure many people are already doing this, but it is pretty simple. Using a calendar, writing things down. I have a lot of individuals that I see that are very resistant to wanting to use some of these strategies. Avoiding multitasking, breaking down larger tasks into smaller and more manageable tasks, working in a distraction-free environment. And even when talking to someone, face directly towards them and make eye contact can help you stay focused to better engage and learn the information. Managing your energy. This is something I often see in a lot of my patients that have epilepsy, is that because of anti-seizure medications, maybe because of stress or mood, energy levels are something that we struggle with. And I often will recommend them to tackle the hardest tasks that they have to do for the day and at the time of the day when they have the most energy. So that also is maybe in the morning for some individuals, maybe it's in the afternoon. I also recommend that they generally are using relaxation strategies when they're overly stressed or really worried or really feeling down. It's going to be more difficult to engage, to learn, to remember. And so I highly recommend that they even use relaxation techniques throughout tasks that they do. And lastly, it's also important to know when to ask for help. I think it's important to involve family and friends for support with organization, reminders, even having shared calendars and notes, whether this is about upcoming appointments, family gatherings, work-related information. Sharing that with a trusted loved one is important because there's no shame in asking for help, because using support will only make us feel more confident and capable. Just to summarize everything that I've talked about, so and before we take questions, the key takeaways is, some of these things are very simple, but I do have individuals that come to see me, and a lot of times this is actually what is the primary, one of these factors or a combination of these factors is actually the primary driving problem behind their thinking skills, rather than the actual seizures themselves. So it's important to prioritize sleep, monitor your medication effects, manage stress, address mood symptoms, stay mentally and physically active, focus on your diet, address hearing or vision loss, and really try to create a toolkit of cognitive strategies. And I think that that certainly can improve one's thinking skills, but also quality of life. Right. Now, I want to take any questions that we might have.
Thank you so much. That was an incredible presentation. Does anybody have any questions to ask Dr. Lenox? I don't see anything in the chat. If anyone wants to unmute and ask, please feel free to do so.
I don't have any questions. I just wanted to say thank you for sharing all that. Very good advice. And sorry, I was like on mute and I was at work trying to get out of the hospital. I got in the car and I was like, my husband was like, "What are you listening to?" I said, "Just be quiet. I gotta listen." But thank you. Now all of it is very, very true. Yes, thank you. Very, very, very helpful.
Well, and something I guess to piggyback on what you were talking about, the Epilepsy Foundation of Kentuckiana and other epilepsy foundations as well, we are offering a CDSMP, which is chronic disease self-management program. And it has been a really incredible program for a lot of the people because it kind of helps with some of those stressors, and it helps really kind of give people camaraderie, and it talks about all of those life skills and nutrition and all of, how to reduce stress in your life in particular, and people can kind of share out. So it's almost like group therapy as well. And so if anybody's interested in that, we have a session going right now, but we'll have another one coming up in the summer. So it's a really good program that we really enjoy, and we've seen people have a lot of great results, as they follow it. So, all right. Well, if nobody else has any questions, thank you so much, Dr. Lennox, for coming tonight and presenting. We are so grateful for you. And I know neuropsychologists are popping up in a lot of our epilepsy centers, which I think is an incredible thing. So if you are not at U of L, please, talk to your provider and see if someone is there to, help you out. And if you are at U of L, reach out to Dr. Lennox if you are needing some help. Thank you so much, everyone. Have a wonderful evening.